we begin the discussion on an issue making headlines. The number of fatalities caused by COVID-19 have been on a decline, but new infections continue to occur across the world. Nevertheless, governments and their populations have been itching to ease restrictions, and countries have been loosening quarantine measures and letting non-essential businesses reopen. But at the same time, there have been concerns about a second wave, especially with countries like South Korea, Singapore and China, which initially contained the virus at an early stage, recently experienced a resurgence of cluster infections. Meanwhile, the WHO warned Europe this week that it should brace itself for a stronger and potentially deadlier second wave of COVID-19. To discuss what a second wave would look like and if it's preventable, we connect with Professor Peter Collignon at Australian National University Medical School, who is also an infectious diseases physician and microbiologist at Canberra Hospital. We also have joining us Dr. Bruce Y. Lee, Professor of Health Policy and Management at City University of New York, who is also a systems modeler and a senior contributor for Forbes. Well, my first question to you, Dr. Collignon. South Korea, which eased social distancing requirements earlier this month, saw a spike in cases recently linked to nightclubs in Seoul. We even saw fourth-hand transmissions take place, and countries like Singapore, Hong Kong and China have also seen resurgence of cases. And this has given rise to worries about the dreaded second wave. So do you think this really is the making of a second wave? And what lessons can we take away from this sudden surge of cases?
Well, I think the lessons we need to take is that this virus is around and is not going to disappear. We know it spreads by droplets, and that means if you are closer than 1.5 meters or 2 meters, if you're in crowds, if you don't wash your hands, you are going to get the virus communicating and going to other people. So if I look at the Korean experience, from what I understand, it was opening bars and nightclubs, probably with alcohol, I presume, so people close together, probably shouting because of noise, so that spreads droplets more readily. And the same in Singapore. They have had a recurrence of cases, but it's mainly in their migrant workers who are sleeping maybe 20 in a room that is probably, not great with ventilation, and people are close together for long periods of time. So whenever we break the basic rules that you've got to keep your physical distance, you've got to use your hand hygiene, you've got to have ventilation, you're better off outside than inside, we are going to get more cases. The only good news is, look at Korea, they got on top of it very early and they were able to, break it down basically so it didn't happen. And I think with lots of testing, providing 90% of us know that these are the rules, then we can actually make sure the spread is minimal rather than another huge second wave.
So everyone really needs to do their part to contain the virus, and that obviously involves taking care of basic measures, as you said. Well, Dr. Lee, the Trump administration has been very adamant about the necessity of reopening economies, and your Health Secretary, Alex Azar, said that if lockdowns continue, it would actually hurt the capacity to address other health needs. But hospitals, they're already overwhelmed as it is, and the report you recently published in Health Affairs, it shows how medical costs could surge to hundreds of billions of dollars if coronavirus infections soar significantly. Is it wise then for governments to actually push for business as usual for the sake of the economy?
Yeah, that's been one problem with this push for reopening. It's really looked at only one side of the equation, and it's assumed that everything will return back to normal before the pandemic. And that's just not true, because when you look at the economy, it's also the medical costs that are associated with COVID-19 and all of the clinical outcomes and the bad health effects that it may have. So if you increase the number of cases of COVID-19, then that will increase the medical costs that are associated with those things, and then people have to pay for that. So those are costs for businesses, those are costs for people who are paying health insurance premiums, those are costs for taxpayers who have to pay for things like Medicare, Medicaid. So it's a very one-sided argument to say, we need to reopen the businesses so that we can improve the economy. It's not the same situation. So we really have to look at what's changed and what's different. And we have to take into account the direct medical.
So what you're saying is that if infections surge, then someone's going to have to pay for it as well. Well, Professor Collignon, based on the 1918 Spanish flu pandemic, some have projected that we'll see a stronger and even more deadly version of the virus in the second wave, especially in European countries. Does this mean that more infections and fatalities will occur? And in countries like South Korea or Singapore, where few people have immunity, will the second wave then be more severe?
Well, it's a definite possibility. I mean, if I look at the Australian experience with Spanish flu, when we're fairly isolated, we had a first wave like we've had now that came up, went down, and then there was a second wave in winter, because in winter probably most respiratory viruses spread more quickly. But it's important to remember also this is different from influenza. Children seem to get it much less frequently. And also if you look at 1918, probably 80 or 90% of the deaths rather than the infections were due to secondary bacterial infection, particularly the pneumonia germ. So it is a bit different because what was killing people before may be different, although secondary bacterial infections may be an issue in this one as well, that we have more superbugs. But basically, the virus is around. So Korea and Australia and New Zealand have got very little transmission. We have a lot of testing in Australia, and we have about 10 or 20 cases per day in the country out of 25 million people. But it means it's still there. So it's not hard if everybody doesn't take droplet precautions, you know, the spacing compromises that too much, then we can easily get a lot of spread, particularly in winter. And winter is a problem because everybody thinks, oh, I've just got the common cold. And 20 and 30-year-olds seem to be the main people that spread this infection. They have a low mortality rate. It's less than 0.1% in them, but they seem to be the biggest group that get this infection. And because they don't get very sick, you can see why it spreads so easily through them. So the group that has probably the least complications, we need to keep on side to make sure they don't spread it. And that basically means physical distancing, hand hygiene, don't go to sick when you work, etc., etc.
So even if we do reopen our economies and resume business as usual, we really need to be very careful, especially the younger demographics. Well, Professor Lee, it seems that every country has its own standard of easing lockdowns, and these days we're hearing a lot about the reproduction number. Do you think this could be the standard bearer of that indicates when you should actually ease your lockdown?
It's complicated. So I think, you know, the reproductive rate represents in general how many new people a single person could potentially infect. So essentially something will increase like an epidemic or an outbreak when the R0 or the reproductive rate is above 1. And when it's 1, it will stay the same. When it's below 1, the transmission will decrease. So the social distancing measures aim to bring the R0 or the reproductive rate down. But the trouble is right now we're having a lot of mixed policies in terms of the reopening. So it's unclear how that's actually going to affect the reproductive rate. And we also have to see, you know, how well will people actually maintain social distancing when some of these businesses reopen? Because as was mentioned earlier, it's not just physical distancing, it's also making sure that you maintain hand hygiene and distant surfaces and all those other things that will.
Well, even though infection cases, they've still been on the rise, Professor Collignon, students in Europe, they're planning to go back to school. Some already have in countries like Germany. And South Korea is also planning to send high school students back to school from Wednesday. And it seems that there are very mixed opinions about this. What does science tell us about how children are likely to be infected by COVID-19? And what precautions do you think that schools should take as they reopen?
Well, what is really clear is that children under the age of 15 seem to get COVID truly much less often. Those that are, you know, 5 to 10-year-olds, 10 times less often than, say, 20 or 30-year-olds. So children are less of a risk than their parents, interestingly. But it's not that they don't get it. Where it's different from flu is that children probably outnumber adults 5 to 1. So closing schools during an influenza epidemic makes a lot of sense. However, the real problem is we're stuck with this virus for quite a while to come. Are we going to keep all schools closed for 2 years? I don't think that's viable. So we need to actually do it in a way that makes sense. Now, in Australia and Korea, there's very little community transmission as far as we can tell. That's quite different to Europe and North America. So I think that's a different situation. But basically, children are reasonably safe and they don't have to quite do the physical distancing of adults, which is good because it's harder to do. But the people that do need to do the right things at the school are the teachers and the parents. So what is really important is that the teachers keep their physical distancing at school from other adults, and also parents don't congregate at school and minimise their interaction with other adults at school, because children are much less of a risk, but they're not zero risk, but relative, it's the adults that have been most of the problem. And in Australia, where they've done cluster investigations, it's usually a teacher who's come back from overseas and spread it mainly to other adults, sometimes high school students, 17, 18, but relatively there's been very little spread from children to children or children to adults, at least in a low prevalence country like Australia.
I see. Well, Dr. Lee, how can governments everywhere, how can they be better prepared for the second wave than they were the first time? And until a vaccine is actually out and ready for use, can we expect to see repeated waves of lockdowns with resurgence of infections like we've seen in countries in Asia?
Yeah, well, we've seen very clear differences in terms of how different countries have been able to handle the spread of the virus. So countries like Taiwan and South Korea, Singapore, and Germany have been more effective in terms of controlling the spread of the virus. And they use a combination of different approaches, strategies that coordinated with each other. So one is widespread testing. So if you don't do widespread testing, then you don't know where the virus is actually spreading. So the countries that were able to put in widespread testing had a better sense of where the virus was actually traveling. And then installing testing, tracing, and isolating programs where you quickly identified people who are infectious and then made sure they were isolated and then identified their contacts and who they might have infected, and then isolating those folks or quarantining those folks as quickly as possible. And also making sure all these things were coordinated, and then making sure the healthcare system was ready, that had enough capacity to quickly take care of patients, and the healthcare personnel had enough personal protective equipment, such as N95 masks, gloves and gowns, face shields, and those types of things. So the countries that were able to do that were much better at controlling the virus, whereas in the United States, you didn't have the testing. Widespread testing. You didn't have these contact tracing programs in place, and many of the healthcare facilities were not ready to handle this virus. So basically, you need to do that to try to get ahead of the second wave. And people talk about testing and the value of it. You really cannot tell what's happening with the virus unless you're testing. You can't guess or imagine. So it's almost like playing a football match without seeing the field. So those things are all very important.
Well, it seems from our discussion today that predicting or anticipating a surge in infections is possibly impossible, but then what governments can do is really coordinate their policies and make sure that they are consistent for the public to follow. Well, it's been a very informative discussion. Thank you very much for joining us today, Professor Peter Collignon and Professor Bruce Y. Lee from Canberra and New York. This is also where we close the show. Thank you for watching. We'll be back at the same time tomorrow with more global insights on issues making headlines. Have a wonderful day wherever you are. Goodbye.